Okay, so this part was actually a case that is presented for opinions, right?
Yes, sir.
Yes, for the opinions of the staff, uh, for, for the opinions of the team, no, the PSS members. Uh, we have only a few minutes. We're extended already, but I think we have some time for questions for the first four presenters. Yes, Dr. Tadhente? Dito na lang. Let's share the mic.
This question is addressed to Dr. Paiso, sir. Um, can you share some of your pearls and tricks with regards to addressing lateral listhesis in adult spinal deformities, preferably in the lumbar spine? Thank you.
First of all, I'm not your senior. I think we're only 1 day apart.
Kailan? Ni Dr.
No, but you're talking about adult degenerative stenosis with lateral listhesis. Well, usually for these cases, an interbody fusion will be helpful in realigning, and you can use a pedicle screws to. The lateral listhesis itself is not the issue most of the time. It's either degenerative instability or the stenosis. So if you address both main concerns, you can accept the minor malalignment. If it doesn't reduce, that's okay. But if your intention is to reduce, then doing probably a more extensive facetectomy and maybe using these tools for reduction, like some of these towers can be used to derotate or to translate. But I rarely use it, I don't find it practical actually. If you address the two main components that are associated with the condition.
Are there any other questions? I think we were requested to flash the slides from Dr. Caro's presentation for the opinion of the PSS members. Dr. Enriga would have some comments.
I'm gathering my thoughts. I'm looking at this.
It's not something that you get to figure out in 3 minutes, right? Huh? Turf natin. Turf. Turf. OI. So the highlights of the case, osteogenesis imperfecta, right?
Highlights for this patient, she has osteogenesis imperfecta. She has completed pamidronate therapy. But we still have a progression of the deformity, which was initially diagnosed in 2008.
To be honest, I've only been involved once ever in a similar case like this during training, during fellowship. So what they did for this case was they used screws very sparingly because of the risk of because of the poor bone quality and the risk of pullout from the screws. What they ultimately did was that was a patient though, instead of scoliosis, it was a very severe kyphotic deformity. What they ended up doing was there were screws at the top of the construct and the bottom, but to hold everything in place, essentially, what would anchor the spine to the rods where they used Nesplon tape at multiple levels, and they were very, very careful instead with the tensioning of the Nesplon tape. But given that I don't know to what extent it's available here, that's one consideration. And so far it held, but they did augment it with a cast, with a mold brace. It looked like a turtle shell essentially, you know. But beyond that, that's about the extent that I've seen them do a spinal deformity with osteogenesis imperfecta.
Shots fired. Meron bang mga dissenting opinions? Meron bang mga ibang plano for this? Marami nang nag-iisip. Si Dr. Chong Sam, mukhang nag-iisip ng malalim. May we hear from the wisdom of the ages.
Well, if we consider the cause of the deformity, which is osteogenesis imperfecta, so the bone will never harden. So whatever you do, the chances of the screws pulling out is great. And as mentioned by Dr. Endriga, they still have to apply a body cast. So why bother going to surgery when you still need a cast? Just give them a cast and follow them up closely.
It's an acceptable option also. Any other opinions? No? Kulang na ba tayo sa time? O sige, pag-usapan na lang natin mamayang tanghalian, no? Dave? Si Dave Dizon, may sasabihin raw? Sabi ni Dr. Chong Sam. So si Dr. Dave Dizon, gusto niya raw ipa-turf sa POC, no? Kung kailan exams ng ITE bukas. Very good. Oo. No? So, yes, Dr. Esteliore.
This question is for Dr. Bruce. You said that si Bruce ba nandito? Hi Bruce. You said that surgery has had good outcomes compared to yung conservative. When we say surgery, is this deformity correction, or could we go away with just decompression? Did they specify?
So they specified on those, particularly one study, they compared strictly fusion and deformity correction. So not plain decompression.
How about in plain decompression? Did they follow up it long term? Did it end up for revision? Revision surgery, parang ganun?
The other study that I mentioned, sir, they included decompression in that. And I think that was one of the limitations of their study, that there was no uniform protocol in terms of what they meant between surgical management. That's why they had better outcomes, I think. But that was one of the limitations.
Thank you, Bruce.
Thank you. So that ends the first half of our of my moderating. Now we have 4 international speakers, no? 2 of which are regional experts from Southeast Asia. One, an